you know to be the most common reason or the most common manifestation of early cardiac problems, especially in young people, young Black people or young Hispanic people?
Well, the earliest manifestation are the risk factors for heart disease. So the things we've been talking about, high blood pressure, diabetes, high cholesterol. And then, over time, if those risk factors aren't managed well, then you can develop, you can develop the blockages I mentioned, potentially heart attacks, heart failure. The early signs, unfortunately, we don't always catch things. Unfortunately, we don't catch things early. We aren't able to catch things early, but the sorts of symptoms you might have that might be suggestive of heart disease might be chest pain or pressure in the middle of your chest when you exercise, shortness of breath, not having the same amount of energy that you ordinarily would. And hopefully, if you're plugged in with a primary care physician and you start to have symptoms, similar symptoms suggestive of heart disease, and there is strong suspicion that you have heart disease because you have risk factors, then your primary care physician can refer you to a heart specialist for further testing.
I see. So again, we come back to Dr. Rina because it's about primary care. Now, we know that many people, again, in the minority community, in the Black and Latino community, many people do not go to the doctor until they feel sick. So prevention is not one of the things we practice very well. Most people would say, I was just speaking to someone she's 62 years old, and she said, I never go to the doctor. She said, I am healthy. What? The only thing I have is migraines. And I said, but how do you know that everything else is healthy? She said, because I feel fine. Nothing happens to me. If something happens, I'll go to the doctor. And this is a common belief and practice. What would you say, all three of you, what would you say to people about the importance of prevention, both for high blood pressure, diabetes, heart disease? Why is it important that we take steps to practice prevention, and what are some of those steps we should start with? Any one of you can start.
Well, I think diet is very important. So a diet that's rich in vegetables, eating lean meat as opposed to red meat. Lean meat might be fish that's broiled or baked, or chicken without the skin. Avoiding foods that are high in fat, sugar and salt. Diet's a very important component.
Okay, so that we're going to come back in this. So that is, prevention is critical in reducing health disparities. We want to say to our audience, if when we talk about health literacy and we talk about health and wellness, we can do more for ourselves than any physician can do for us if we listen and are proactive. Don't you agree?
I agree. I think let's take the two diseases we're talking about mostly, which is hypertension and diabetes. It's much easier to try to prevent them than to treat them, because so hypertension is a lifelong disease, as is diabetes. So as soon as you develop them, you have it for life. But if you do things like eat properly and exercise, and watch your weight, then you can mostly prevent diabetes and hypertension.
So if you said once you develop it, you have it for life. Now, hypertension, again, we're talking about high blood pressure. You're saying once your blood pressure is high, it's always high?
So once your blood pressure becomes high,
yes.
Sometimes if you do the right thing and have lifestyle modification, that is you eat differently or you exercise differently, sometimes it can go back to normal, but you're always at risk of developing hypertension again. But very often hypertension, we see it when it's well established. And when it is well established, it's very hard to get rid of it. So you have to always be under treatment. So very often what happens with patients who treat for hypertension is that they feel better as you treat them. For instance, the person you were talking about, the migraine, for instance, could be from high blood pressure.
Really?
Yes. So that's one of the signs of hypertension or headaches. So, but as soon as you start feeling better, patients sometimes stop the medications and you go back to the same thing. So prevention is one thing, but also we should emphasize detection. And so you might do everything you can do to prevent developing hypertension or diabetes, but you might still develop it. So you need to go see your primary care physician so you can be tested to see whether or not you have hypertension or diabetes.
Okay. Were you going to say something, Dr. Thande, about this?
Well, yes, I agree that detection is very important, primarily because there are genetic factors as well that play into the development of disease, and we don't necessarily have control over those, even though you may have a genetic predisposition to hypertension or diabetes. Lifestyle is still important, but you might do everything correct. You might do everything you're supposed to do and still develop disease, and so that's why following with a doctor is very important.
Okay, now, were you going to say something?
Well, I can just add that for a disease like high blood pressure or kidney disease, it can be silent and you may have no symptoms. And so it's important to see a doctor and get screened for these diseases.
So again, prevention is so important. Now, family history, there are many people who believe, well, my grandfather had it, my father had it, I am destined, so therefore I cannot do anything about it. But of course, family history does not have to be destiny. Because even though your parents or grandparents had hypertension, you can do those lifestyle modification you talk about to make sure that your hypertension doesn't become life-threatening, or damage other organs.